Hi, I'm Dr Rob Perel. I'm a heart rhythm and cardiac device specialist at Queensland Cardiovascular Group, and I also perform a rural clinic once a month on the Heart of Australia truck. Cardiologists who deal with heart rhythm problems particularly, we call ourselves cardiac electrophysiologists or heart rhythm and cardiac device specialists. We have special training in diagnosis and then invasive management of people with heart rhythm problems. A person would describe the heart racing. My heart's racing, I feel really unwell when my heart races, or my heart feels like it's going too slow and I feel dizzy, or I'm getting skips and thumps and this pounding in my chest all day long. To figure this out, you need to record the heart rhythm at the time that you've got the symptom. So an ECG, which is an electrical tracing of the heart, is the way to get the diagnosis. But most of the time when you turn up to the doctor, the heart won't be racing, there won't be any palpitations, and this can be a very intermittent problem. And so to investigate an intermittent problem, then you need some form of longer term heart rhythm monitoring. We can do a 24-hour Holter study or a 24-hour ECG recording. We can send people out with a 14-day event recorder. It lives in your pocket until you have the symptom, and then you try to get that device on your skin to record your heart rhythm at the time you feel the symptom. Another way to get that information is some new technology by having an ECG recorder on your smartphone, and then you can record the rhythm problem yourself and bring it in for a review. The heart's a muscle that pumps blood, but it knows when to pump because the electrical circuits within the heart tell it when. The heart beats every second because the electrical circuits tell the heart when to beat. When the heart's racing, the electrical circuits are out of rhythm. And they can be out of rhythm for a number of reasons. One reason is that there's an abnormal electrical circuit in the heart. If a person has that condition, they were born with an extra electrical circuit or a pathway. That can be treated by medication, but also it can be treated through an electrophysiology study and catheter ablation, and this is a procedure where an electrical catheter is put inside the heart to localize the accessory pathway. Once that pathway is located, an ablation can be performed which puts a block into the pathway and essentially fixes it. If you've got a fast heartbeat that the ECG suggests is being caused by a re-entry circuit in the heart, which is an abnormal pathway that the person would have been born with, then an electrophysiology study can diagnose that. And we put catheters in the heart to interrogate the electrical system of the heart. Catheters are floppy little electrical wires that get put into the heart from the vein in your leg and pass gently up the vein from below and sat in the heart in positions where we can check which direction the electrical flow goes through the heart. Ablation is a technique of putting electrical current through the tip of a catheter, causing some heat and gently burning the inside wall of the heart to leave a focal and very small scar which is not harmful to the heart. And so if the pathway can be burned away, then the palpitation cannot happen anymore. The medical treatments for heart rhythm problems are antiarrhythmic medications, and there are a number of choices, and each choice depends on the nature of the problem. As part of a workup to try and figure out what your heart rhythm problem is, aside from capturing a recording of the rhythm problem, it's also important to put the rhythm problem into the context of, do you have any other heart disease? So if you've got a structurally normal heart, then most of the time your palpitation is going to be very benign. An echocardiogram is a simple test to find out if your heart appears structurally normal, and so as part of a routine workup for palpitations, an ECG and an echocardiogram is what you need to have done. If you're suffering from an arrhythmia or a heart rhythm problem, then ask your GP for referral to a heart rhythm specialist. You may learn that your problem is easily fixed with either a medication strategy or an invasive procedure called an ablation.